today's topic of my presentation is the emergence of multiple antibiotic resistance in culture sensitivities of post-surgical patients in a tertiary care hospital. This is our hospital and the team of our faculty. So before starting, let me quote a incident. We received a patient in emergency with the complaint of abdominal pain, and she was having the signs of peritonitis. We operated on her. There was ileal perforation, and we made ileostomy. On the third postoperative day, her midline abdominal wound started getting purulent discharge. We get the culture sensitivity, and this was reported. So all the antibiotics that were related to the organism were resistant. So it was very concerning for all of us. So we conducted a retrospective research, and our objective for that was to isolate the organism that were developing resistance, as well as the drugs that are not performing well, so that antibiotic policies can be formulated. It was an observational study done from July 2020, 1st July 2021 to 31st December 2021. We accumulated 195 culture sensitivity reports from 85 patients, and they were mostly the blood cultures or the pus or the urine samples. So antibiotic resistance is a growing public health concern, and even the cleanest surgeries can get infected. Being a general surgery resident, we are encountered with the intestinal perforations very commonly in Pakistan. So GI tract has a very high rate of getting infection, the surgical site infection. Other than that, the nosocomial infections that develop after 48 hours of hospital admission, they are also very much problem. So this was the results. Approximately 70% of the bacteria, 70% of the growth was from the bacteria, 33% samples were having no growth, and 3% were having fungal growth. And this was the incidence of the bacteria. Approximately 94% of the bacteria were E. coli, Acinetobacter, Pseudomonas, and Klebsiella. These were the bacteria that were mainly causing the problem of resistance. And when we checked through the antibiotics, majority of the antibiotics that we are using very commonly were resistant to those bacteria. Even the best response was from amikacin, and that was not even 50%. Similar reports were seen from the other antibiotics as well, from as broad spectrum as meropenem and imipenem. They were also more than 50% resistant. So this is also displaying the resistance from the antibiotics. Broad spectrum antibiotics like linezolid and clindamycin, they were also very much resistant. So this is what the actual picture was. Majority of antibiotics were resistant to majority of the bacteria. Only few medicine were effective to specific bacteria. This was the antibiogram made. And this is not the problem belong to just Pakistan. It is a problem from all over the world. The bacteria are getting resistant a lot in orthopedic patients as well as the general surgery patients. So in conclusion, it is very important to devise antibiotic prophylaxis policy so that we do not give antibiotics to those patients who do not need antibiotics. Rather than treating the infection from antibiotics, we should improve our hand hygiene and operation room sterilization so that we can control the sepsis. And culture sensitivity swabs should also be taken in a very appropriate fashion so that we do not miss any bacteria and that can risk the patient as well. And in present day surgical practice, implementation of standard guidelines in hospital are required to lower the risk of antibiotic resistant crisis. These are the references which I took, uh, showing all the um, antibiotic resistance all over the world. This was our study that is published in Curious Medical Journal. If anyone want to read about it more. And thank you so very much. Any questions, please?